My name is Davi Khalsa, and I am a certified nurse midwife. I practice in Los Angeles, California, and I have a home birth practice. More and more women today are realizing and they're seeking alternatives to the normal standard of care given by doctors in the hospital. I mean, there's, of course, medical technology, without doubt, has saved many lives of women and babies. That is without saying, and thank God. However, what's happened in the most recent past and today is those life-saving techniques and those interventions, once used only on high-risk or complicated situations, have now become the standard and the normal for women that are very healthy and are considered low risk. Low risk means that they don't have history of diseases. They don't have heart disease. They don't have history of diabetes. They don't have preeclampsia. They're relatively healthy. And yet they're in a hospital situation and their low-risk status has been channeled into a high-risk situation because of the interventions done. People that work in the hospital, they work there because they want to serve and they want to take care of the woman in labor. And the doctors do too. They're there in their heart, they want to serve and they want to help this woman in labor. The philosophy of helping in the hospital is with medication. And it's with interventions because they think that's the best. And that's fine if that's your philosophy as well. But if your philosophy is less is better, you're not going to get the support in a hospital setting, unfortunately. If you choose midwives in a hospital, you will get more support. That's true. And at home birth, of course, it's so easy to have a natural birth because that is the focus, that is the commitment. When you're committed to experiencing your labor and birth without medicine, without pain relief, put it that way, and you're committed to doing it without pain relief, it's so much easier. Yeah, there's a commitment. It's so much easier because there's not a carrot hanging in front of your face. Oh, if it gets too painful, we can have this, little bit of medicine. That's not a choice at home. So the commitment is taking place beforehand. I want to do this. I want to do this journey with my baby and my partner. I want to feel it. I want to be with my baby. I want to be able to move. I want to be able to be in water. And while a woman is in water, while she's moving, while she's eating, and while she's drinking at home, the midwife, of course, is making sure that she stays in the realm of normal and she's safe and the baby's safe. How? By doing what a hospital does, but just doing it a different way. And that's the truth. A lot of people don't understand that with midwives at home. If I go to the hospital because I'm in labor and I'm having a baby in the hospital, what do they do for me when I go there? Well, they want to get my blood pressure, they're going to get my temperature, they're going to get my pulse. That's what they do for a woman. What happens at a home birth when a midwife comes to the house? The midwife gets the woman's blood pressure, her temperature, and her pulse. Of course, we do a little more. We want to ask how she's feeling, how she's doing, is she drinking enough, is she eating, is she maintaining good balance. What do they do for the baby in the hospital? They listen to the baby's heart rate. And in a hospital, they listen continually on the electronic fetal monitor. At home, we listen to the baby's heart rate too. Of course, we have to know the baby is doing fine and is safe and is up for the journey. We do it differently. We don't listen continually. We listen intermittently, which is a protocol created by the American College of Obstetricians and Gynecologists. Every 30 minutes in active labor, we listen to the baby's heart rate for low-risk women, every 10 minutes in pushing with a low-risk mom. And there have been multiple studies comparing continual listening to the baby's heart rate compared to listening intermittently. And studies have proven that listening intermittently is as safe, if not safer, than listening continually.